Hi, this is Dr. Niedweske with Dr. O'Neill. This is our third podcast. We're going to be discussing um, the initial introduction to holistic medicine. Dr. O'Neill has been out of school for quite some time. She's old like I am. And we work together in North Jersey, and she's an excellent veterinarian, probably one of the best I ever worked with. And if you have a question for her, I'm sure you can reach her. She will definitely tell you what's on her mind. So, what we're going to do is some common things that you can do with holistic medicine. And also, I asked her to discuss the raw diet, which there's always a controversy about. So, I am going to introduce Dr. Marjorie O'Neill, and I appreciate that she came on to help us out. So, Marge, it's all yours.
Okay, so I work at what would be considered an integrative practice, which means that we have 10 doctors, each with their little niches in the practice. Mine happens to be holistic medicine, but we all do practice conventional medicine, which is what you're all used to. You come in, you get an exam, we get a history, maybe some tests are done, diagnosis and medication is dispensed. But on the complementary side, we offer things like cold laser. Um, I have an herbal pharmacy there. I've got some of the other doctors that are integrating some of the herb medicine with their conventional treatments. Um, with the complementary and integrative medicine, the process is very similar. Take a history, do an exam, maybe do some tests, but the treatments may be different. Um, there is a balance between the two. I think there's a place for both. And as I said, I've got some of the other doctors that are integrating some of the herbal therapies with their conventional medicines. Um, Sometimes it's personal preference. I have clients that come to me and they would rather have an herbal formula before they would go to a conventional medicine. Sometimes it's the patient. Um, we have a lot of issues in both human and veterinary medicine with antibiotic resistance. Um, a lot of the bugs that we treat are becoming resistant to most of the antibiotics that we're using, which is very perilous for the future. Um, with herbs, it's impossible for a bacteria to become resistant to an herbal medication. The difference being that with antibiotics, the bacteria only has to adapt itself and become resistant to one chemical. With herbal formulas, one herb might contain 100 to 1,000 or more of what are called phytochemicals that work together to fight the bacteria or the virus for that matter. So it is impossible for an organism to develop resistance to all of those chemicals, which is nice because I've got animals that have not responded to antibiotics. They've got so many resistant organisms, and they work very nicely. The phytochemicals in the herbs, as I said, work synergistically. They enhance each other's action. So individuals, once the problem is identified, herbal formulas are compounded to the individual. Um, I've got dogs that I have weaned off of Prozac because of separation anxiety or other anxiety issues, and I give them chamomile tea. I give the owners a dose based on their weight, and I have them pour it over their kibble um, a couple of times a day. Chamomile tea relieves anxiety, and it has a mild sedative effect. That's why people drink it before they go to bed. So it works very nicely. For kitties, I have a liquid tincture that the owners squirt into their mouths. So it does work very nicely. And on that, there's something called feline lower urinary tract disease in kitties that mimics a bladder infection. They will have the exact same symptoms. They'll strain to urinate. They might see blood in the urine. But feline lower urinary tract disease is an anxiety problem in kitties. Um, Something in their household is causing anxiety, whether it's the other kitties, whether it's whatever's going on in the household. Sometimes it's something that you might not even identify because you're not a cat. I put these kitties on a combination of marshmallow root and chamomile. The chamomile relieves anxiety. The marshmallow root is anti-inflammatory for the urinary tract. I've got cats that for years have been urinating all over the house. They come in, they get a urinalysis. It looks like a urinary tract infection. So they get put on antibiotics, which might help for a week or two. But as soon as they come off of it, they're urinating all over the house again. So I put these kitties on the chamomile and the marshmallow root, and usually within a week or two, they're not urinating all over the house anymore. So kitties are happier because they're more comfortable. The owners are happier because they're not urinating all over the house. I've got dogs with chronic ear infections. They go on antibiotics. It clears up for a little while. A week or two after coming off antibiotics, the infections are back. I've had dogs that come in, looks like somebody poured boiling water in their ears. So I make them up a solution of calendula. Calendula is a flower. It's actually a type of marigold. You can buy the dried herb, but I have liquid tincture in my pharmacy. You mix it with distilled water or filtered water and squirt it into the ears. You don't even have to do anything. Just squirt it in the ears. Let the dog shake it out. And I usually put them on a gradually, daily for a week, and gradually wean them off of it. You can always restart it. I have one dog right now. The owner has been using it for several months. It's the only thing that keeps her dog's ear infection at bay. Dog's 15 years old. She doesn't want to, get too crazy with him. As long as she pours that calendula solution in this dog's ear is fine. Because as I said, the bacteria were resistant to all the antibiotics that we tried. So calendula works very nicely. It's antibacterial. It helps things heal. So that works very nicely. Dogs with allergic dermatitis. I have the owners make up some green tea, and in their final rinse, they will add the green tea to the rinse water. Green tea is very soothing. It's anti-inflammatory, and you just let it dry on the dog's skin. And it works very nicely. Locked kitties that come in with urinary obstructions. One of the things we used to do is put them on something called prazosin to relieve the bladder contractions. Prazosin's fallen out of favor. I switched to saw palmetto. Saw palmetto, a lot of commercials for saw palmetto for human males with prostate disease. Well, saw palmetto does nothing for the prostate, but it relieves the spasming of the urethra. So I'll put these kitties on it while they're in the hospital. I'll send them home with it for about 10 days afterwards until the infection is cleared up. But again, drugs don't work. They have side effects. Herbs have very few side effects. They've documented over the last several years, they've documented hundreds of thousands of adverse reactions to most of the drugs on the market for whatever purpose. In herbs, a tenth of a tenth of a tenth adverse reactions. They just don't have them. They will sometimes react with medications. So, just like any other drug, we always make sure that what we're prescribing is not going to react with anything else that they're on. But adverse reactions to drugs are almost non-existent. They will list them in the literature, but they're usually based on theory because of something that's happened to a person. Very, very few have ever been documented to occur. So they're actually not that drugs are innocuous. You can have reactions to them, which is why you need to consult an herbalist, but very, very few reactions.
Quick question.
Um,
Quick question. Do you ever have issues with using the herbal medications with traditional drugs as well? Any reactions with antibiotics, for example, and any of your drugs that they should know about? People should ask any specific questions about?
no reactions with antibiotics. There are some drugs, not to get into too much biochemistry, the enzyme systems in the liver that metabolize whatever drug you're taking. Some herbs will inhibit those enzyme systems. So if you're taking a drug that needs that enzyme system to be metabolized, if the herb inhibits it, the drug's not going to be metabolized. It's not going to work. Some herbs will enhance that enzyme system. So that you might over metabolize and risk an overdose. One good example is St. John's wort. St. John's wort is used for a lot of anxiety issues, but St. John's wort inhibits those enzyme systems. And there have been a number of reported cases, not in animals, but in people, especially transplant patients, where they weren't metabolizing. They were on anti-rejection drugs and they started on their own without telling their doctors. They started taking St. John's wort over the counter for anxiety, and they ended up losing their transplanted organs because they weren't metabolizing their anti-rejection drugs. So just like mixing conventional medications that can interact with each other, yeah, you always have to make sure that the herb that's being prescribed is not going to interfere. I had a case several years ago. It was actually when we were practicing in Islin. I had a kitty diabetic that was, and this is before I was actually doing herbal medicine myself, but I had a kitty that was diabetic, very well controlled on insulin. And all of a sudden, within a month, this cat came in twice hypoglycemic. And it turns out that the owner was, while she was seeing me for the diabetes, she was also seeing a holistic veterinarian in North Jersey who, and I honestly don't remember what herb she prescribed at this point, but I looked it up when she told me she was doing this. I looked it up at that time, and the herb that she was prescribing counteracted the or enhanced the action of the insulin. So the owner was giving the proper dose of insulin, but the herb was was enhancing its action. So this kitty's blood sugar was going too low. So yeah, that's the responsibility of the prescriber to make sure that nothing is going to interfere. And I always check on that.
So the moral of the story is don't talk to Dr. Google and just dose it yourself. So,
That's true.
you know,
So, and unfortunately, herbal medications are available almost everywhere. Um, and as I said, nothing is innocuous. You can always have, if you're prescribing something like calendula or chamomile, you have to make sure that you don't have an allergy to that family of flowers. If you're allergic to something in the aster family and you take chamomile, you're going to have an allergy to it. So they're not they do have their downside just like anything else. So you just have to pay attention to what you're doing. I use a lot of immune stimulants. I try to get all my geriatric patients onto a product called the Five Defenders. The Five Defenders is a mixture of five different medicinal mushrooms. It's a mixture of reishi, maitake, coriolis, cordyceps, and turkey tail mushrooms. Each medicinal mushroom has, they all do pretty much the same thing, but each one does something special. And when you mix them together, they enhance each other's activity. Um, Turkey tail has been used for years for hemangiosarcoma, those splenic tumors that we see, especially in shepherds. So when it's mixed with the other herbs, we can use it for that, but we can use it just to enhance immunity. Medicinal mushrooms are anti-inflammatory, they're antiviral, they're antibacterial. Um, in people, they actually help lower cholesterol. So I try to put all my geriatrics on Five Defenders. I will also make up um, special formulations. I had a little ancient little Boston Terrier rescue come in. Dog was a train wreck. It's got heart disease, kidney disease, had terrible skin disease, um, horrendous teeth, and the owner wanted strictly herbal formulas. So I put together a formulation of some astragalus, which is an immune stimulant, calendula, which again is antibacterial, anti-inflammatory. I mixed in some echinacea, which is antibacterial, and I started this dog on it. And I just saw this dog a couple of months ago. You wouldn't even know it's the same dog. I mean, it's not going to cure the heart disease, it's not going to cure the kidney disease, but the skin looked wonderful, the mouth looked wonderful, the dog looked like it was feeling very well. It was a happy little dog, and it's like 15 years old. So they work very nicely. I put my dogs with cognitive dysfunction syndrome, that form of senility, I put them on ginkgo biloba. They do very nicely. And again, no side effects to worry about. My arthritis dogs, I put on something called Boswellia complex. When we put them on non-steroidal anti-inflammatories, you got to do blood work before you start it to make sure they don't have liver and kidney issues. You have to do blood work every 6 months to make sure you're not getting into liver and kidney issues. Boswellia complex is a mixture of boswellic acid and turmeric, both of which are anti-inflammatory and analgesic. It also contains celery seed. Celery seed inhibits the same inflammatory chemicals that nonsteroidals inhibit. And it contains ginger, because the articular cartilage that covers the joint surfaces does not have its own blood supply, gets its blood supply from the bone it sits on. Ginger increases that blood supply to the joints or the articular cartilage. So that works very nicely. With gastrointestinal issues, I put them on licorice root, which is anti-inflammatory for the GI tract. Dogs with diarrhea, I'll put on slippery elm. Slippery elm is a coating agent, kind of like Pepto-Bismol coats the lining of the intestine or the lining of the GI tract. That's what slippery elm does. I'll sometimes put them on bentonite clay for diarrhea. Powdered form, doesn't have any flavor or odor, so the dogs don't mix it with little canned food or at least wet food. Cats as well. Bentonite clay works very nicely for diarrhea. It also absorbs toxins. And it's, people take it too. Again, just mix it with the food. So that works very nicely. It's hard to get people to accept the fact because people are so used to conventional medicine, but more and more people are coming in, and it's much more acceptable these days. People are actually asking for it as opposed to some of the medications. So I just for my own satisfaction, actually document my cases. Every patient that I put on an herbal formula, I keep a copy of their chart in a special folder, and I make notes to myself so I can follow how they're doing on it.
Is
But
there a
it
website?
does.
Sorry. Is there a website where people can go to find a holistic veterinarian rather than just kind of going to somebody who plays with it a little bit, but really has the knowledge that you do?
There actually is the American Holistic Veterinary Medical Association keeps lists of members. The Veterinary Botanical Medical Association also keeps lists of members. So, and that's usually how people find me. We did have somebody in this area though, because again, our practice is not strictly holistic; it is integrative. We did have a veterinarian in this area who was strictly holistic, and the gentleman passed away last year. God, I think he was like 75 years old, and so his clients are now heading my way. I see a holistic practitioner.
But how about a little bit about the raw diet and what diets you would recommend on that?
Um, Raw diets, I don't have any brands to recommend. The profession has typically shied away from the raw diet because of its potential for contamination with E. coli, salmonella, and listeria. But I think the tide is starting to turn on that. The manufacturers, I think, are and there are a lot of manufacturers that will ship right to your door everything from what looks like a stew-based diet you keep in the fridge, it's already portioned out, to oh, I can't even think of what they call them. It's like a whole diet where I was at a conference and they were showing us pictures of a dog dish with like a dead chicken in it, and it's a whole food thing. They don't even process it, which is fairly disgusting to look at. But the industry is well aware of the concern for the potential for contamination, and they are taking steps. I think the jury is still out on some of those steps that they're taking. Some companies are irradiating the food. Some of them are minimally processing the food. So they are trying to deal with the potential for contamination. But there's still a lot of information that needs to be looked at yet. But as far as the nutritional value, um, everybody I think is familiar with AVCO, the Association of food control officers. And, we all know to look at the pet food, and if it says it's AVCO certified, then it's assumed that it's all nutritionally complete. What is not generally known is that very few of the nutrients that dogs and cats need to stay healthy, very few of those levels have actually been worked out with objective research. So that AVCO seal of approval sometimes is a little questionable. But raw foods they appear to be much more digestible. They promote better health than the high heat processed pet foods. Just as with people that are on macrobiotic diets, as opposed to or minimally processed foods, as opposed to the highly processed foods, the gut health seems to be better. The immune system seems to be better. They've even done studies where they have fed raw food diets to pregnant dogs and then followed the litter as they grew up. And they found out that as they got older, they developed a lower incidence of inflammatory bowel disease, lower incidence of cancer. So, it translates, from mom to baby, because mom had better immunity. So it seems to benefit the babies. Just as they've said for people, that high heat processing, especially of meats, alters the structure of the proteins and actually creates carcinogens. That's why they tell people that, grilling food is not good, or, cooking their meat at a really high temperature is not good, because you're actually creating carcinogens. So I think it's slowly happening. I'm becoming more of a convert to minimally processed foods, not necessarily completely raw, because I still worry about the bacteria in there, but at least minimally processed, not processing the food at that really high heat that the pet foods do. And even commercial pet foods are not as sterile as we once used to think. There was a study done where they didn't say how many, at least in the brief report that I read, they didn't say how many pet foods they tested, but they actually took commercial pet foods. They took dry foods and cultured them, and 33% of the dry foods that they cultured actually came back contaminated with E. coli. And 4% of the canned foods that they tested were infected with cryptosporidium, which is a nasty intestinal parasite. Um, so nothing is sacred anymore as far as raw versus commercial. And so owners that question it, I don't tell them to go out and necessarily feed a completely raw food, but I send a lot of people, I think just like you do, I send a lot of people to that Balance It website.
Mm.
Um,
It's a great site.
because I've got clients who think that if you throw a little chicken and broccoli in a dish, that's enough for the dog. It's not. They need more than that. Um, People shy away from organ meats. Well, organ meats are where most of the taurine comes from, especially the heart and the liver. There is a place for home cooking if people are willing to home cook, but you need to make sure that the diet is completely balanced. So I do send a lot of people to that website. Um, I saw a client asked me about Farmer's Dog recently. Well, I'd heard the name, but I really wasn't familiar with it. It's supposedly a minimally processed food that they actually deliver to the house. But if you look at their website, it'll say things like nutritionists on staff. Well, are they human nutritionists? Or are they veterinary nutritionists? They don't specify.
That's why I
So at
like
least
balanceit.com.
exactly, at least they are board certified veterinary nutritionists. So I do send a lot of people to that website if they're willing to cook at home.
Well, I think that was a
So
pretty good overview. I appreciate you coming on and discussing it with us, and hopefully we'll get you back to maybe do some acupuncture and maybe do a little bit of more in-depth discussion about some different disease states.
absolutely.
So I want to thank Margie for coming on. Hope you all enjoyed it. If you have any questions, you can send me an email and we will talk to Dr. O'Neill and we can go ahead and get her back again for some other questions. So thank you all for watching. Hope it was informative.